Welcome to Pennsylvania in Focus. I'm Kristen Smith, Pennsylvania editor for the Center Square. Joining me today is the Center Square's Pennsylvania reporter, Anthony Hennon. This week, researchers said that in a grim turn of events, opioid overdose deaths skyrocketed during the pandemic. This despite broad flexibility granted to medical providers to treat patients in new ways. It begs the question, how would that rate change again once these flexibilities are revoked, if they do get revoked? First, Anthony, can you talk about what these flexible treatment options are that have been used specifically for opioid use disorder?
Yeah, so I would actually say what's concerning here is even with more flexibility, more access being expanded, we still saw this climb in overdose death rates. So if this flexibility hadn't happened, I think that the death rates would be even higher, which is very concerning. So on the federal level, essentially, when we're looking at what changed during the pandemic and what the federal pandemic emergency rule allowed to happen, there's an expansion of telehealth. There was a little more flexibility from the DEA regulating doctors and what they could prescribe. And they also expanded the ability for opioid treatment programs to grant take-home doses rather than requiring people to go into a clinic to get methadone or other anti-addiction drugs. In Pennsylvania is a little different here, similar to states like Ohio, where you already had such high numbers of people dying every year from overdoses that our increase wasn't actually that great. I think the major spike here came in other states that weren't necessarily already in the top 5 or 10 states nationally. So Pennsylvania, you didn't see as big of a spike. I think that's kind of grim consolation simply because our rates were already so high. There wasn't a lot of room for them to keep climbing so high. So when we're looking with the end of the federal pandemic emergency, we're seeing movement on the state level to keep in place some telehealth expansions, such as allowing physicians to prescribe medications over the phone or with a video call rather than an in-person meeting. And that rule specifically has been extended another 6 months outside the end of this pandemic emergency being ended, simply for the DEA and other federal agencies to consider more public comments and weigh whether to end that rule or extend it or do whatever else. But a lot of this has kind of been a shift in terms of access, of making sure more people can get prescriptions for anti-addiction drugs, to have some flexibility on where and when they can take methadone and other drugs similar to that. And just really emphasizing just how massive this change was with expanding telehealth rather than having it kind of overregulated or regulated to serve smaller populations. You know, a lot of this was coming out during a panel held by the Foundation for Opioid Response Efforts and kind of exploring how opioid addiction treatment has changed in the past few years. One expert testifying categorized it as telehealth was a complete game changer for people working in the safety net. That came from Andrew Herring, founder and director of the addiction treatment provider California Bridge, obviously out in California. He said that we just need common sense enabling of providers to use telehealth to reach people efficiently. So one of the major arguments here was essentially, rather than having a lot of these bureaucratic rules, accepting that we have healthcare providers and experts working, essentially defer to them to know how to prescribe this and how to treat patients, rather than having them jump through hoops that previously they just decided it was too much effort or too difficult to navigate. And now, at least until these regulations ended or are on a state-by-state basis, deferring to them to choose how to treat rather than leaving it to these federal and state regulations.
You mentioned state-by-state basis regarding how we're going to move forward on addressing these treatment issues. But from your prior reporting, it sounds like Pennsylvania has already kind of made the decision that we should make telehealth a more permanent solution to treating opioid disorder.
Yeah, I think when you're looking at Pennsylvania, you're looking at a couple of things here. One is simply preserving a lot of some of these telehealth gains that have happened, making it easier for patients to have a phone call or a video call with their physician rather than having to go into an office. Kind of expands things for people who may have trouble finding childcare or may have trouble with transportation, especially in the rural areas, if they have to drive 45 minutes to get to a doctor's office. So those can be lingering issues. We've seen more state investment, either in things such as drug recovery hubs to support people suffering from opioid use disorder, more funds for addiction treatment statewide. Just last week, the Department of Drug and Alcohol Programs announced that they're sending out about $16 million to almost 24 different organizations to deal with opioid addiction and prevent fatal overdoses. So I think there's kind of two parts here. One part is The governor and the General Assembly are looking at some of these rules they can relax on the state level to make telehealth more accessible, or finding ways to remove barriers between physicians and patients they're treating. And another level is simply directing more funding, either from the general budget into healthcare, or taking some of the money from the opioid settlement that's coming in, which over the next 18 years, Pennsylvania will spend a bit more than $2 billion due to these opioid-related settlements from a number of pharmacies and pharmaceutical companies. So it's a good bit of this will be going out on the county level rather than statewide, but we're seeing action both on the local and the state levels.
Listeners can keep up with this story and more at thecentersquare.com. For Anthony Hennin, this is Kristen Smith. Please subscribe and thanks for listening.